Your body is a complex and amazing machine that can do many things, but sometimes it can also send you signals that something is not right with your health. These signals may be subtle, silent, or easy to ignore, but they could also be signs of serious problems that need medical attention. Here are 13 hidden signs your body is trying to warn you about something, and what you should do if you notice them. So, let's get started. 1. Unintentional weight loss. If you've lost more than 10 pounds with no diet or exercise changes, get it checked out, says Richard Wender, MD, Chief Cancer Control Officer at the American Cancer Society. Unexplained weight loss happens most often with pancreatic, stomach, esophageal, or lung cancer. It could also be a sign of diabetes, thyroid problems, or digestive disorders. 2. Damage to your teeth. If your dentist notices that your teeth enamel is worn down, especially at the back of your mouth, it could be a sign of acid reflux. Acid reflux is a condition where stomach acid flows back into your esophagus and mouth, causing heartburn, indigestion, and damage to your teeth and throat. Many people with acid reflux don't feel any symptoms, but they are at risk for esophageal cancer. If you have frequent or persistent heartburn, coughing, wheezing, or a sour taste in your mouth, see a gastroenterologist for diagnosis and treatment. 3. Itchy, blistery skin rash. If you have a rash that looks like eczema but doesn't go away with creams or ointments, it could be a sign of celiac disease. Celiac disease is an autoimmune disorder where eating gluten, a protein found in wheat, barley, and rye, triggers an immune response that damages your small intestine. The rash, known as dermatitis herpetiformis, is caused by antibodies that collect under the skin. About 25% of people with celiac disease have this rash, and many don't have any digestive symptoms. The only treatment for celiac disease is a strict gluten-free diet. 4. Tearing sensation in your back. If you feel a tearing sensation in your back that is not related to any physical activity or injury, it could be a sign of a life-threatening condition called aortic dissection. This is when the inner layer of the aorta, the largest artery in your body, tears and blood flows between the layers, causing them to separate. This can lead to a rupture of the aorta or reduced blood flow to vital organs. Aortic dissection can cause severe chest or back pain, shortness of breath, sweating, fainting, or stroke-like symptoms. 5. Changes in handwriting. If you notice that your handwriting has become smaller, more cramped, or less legible than before, it could be a sign of Parkinson's disease. Parkinson's disease is a neurological disorder that affects the movement and coordination of your muscles. One of the early signs of Parkinson's disease is micrographia or small handwriting. Other signs include tremors, stiffness, slowness of movement, balance problems, and loss of facial expression. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us, and let us know what kind of content you want to see more of. 6. Snoring. Snoring may seem like a harmless annoyance to you or your partner, but it could also be a sign of sleep apnea. Sleep apnea is a disorder where your breathing stops and starts repeatedly during sleep. This can cause low oxygen levels in your blood and disrupt your sleep quality. Sleep apnea can increase your risk for high blood pressure, heart disease, stroke, diabetes, and depression. If you snore loudly or gasp for air during sleep, or if you feel tired or sleepy during the day, you should see a doctor for a sleep study. 7. Yellowing of the eyes or skin. If you notice that your eyes or skin have turned yellowish in color, it could be a sign of jaundice. Jaundice is a condition where there is too much bilirubin, a yellow pigment, in your blood. Bilirubin is produced when red blood cells break down, and it is normally eliminated by your liver. Jaundice can indicate liver problems, such as hepatitis, cirrhosis, or liver cancer. It can also be caused by gallstones, pancreatic cancer, or hemolytic anemia. If you have jaundice, you should see a doctor as soon as possible. 8. Swollen feet or ankles. If your feet or ankles are swollen, it could be a sign of fluid retention or edema. Edema can be caused by many factors, such as sitting or standing for too long, eating too much salt, pregnancy, or menstrual cycle. However, it can also be a sign of more serious problems, such as heart failure, kidney disease, liver disease, or blood clots. If your swelling is persistent or severe, or if you have other symptoms such as shortness of breath, chest pain, or weight gain, you should see a doctor. 9. Frequent urination. If you find yourself going to the bathroom more often than usual, it could be a sign of diabetes. Diabetes is a condition where your blood sugar levels are too high because your body either doesn't produce enough insulin or doesn't use it properly. High blood sugar levels can make you thirsty and dehydrated, which can make you urinate more. Other signs of diabetes include increased hunger, fatigue, blurred vision, slow healing of wounds, and tingling or numbness in your hands or feet. 10. Changes in moles. If you have moles on your skin, you should check them regularly for any changes in size, shape, color, or texture. These changes could be signs of skin cancer, especially melanoma. Melanoma is the most dangerous type of skin cancer because it can spread to other parts of your body if not treated early. You should see a dermatologist if you notice any changes in your moles. 11. Difficulty swallowing. If you have trouble swallowing food or liquids, it could be a sign of dysphagia. Dysphagia is a condition where the muscles and nerves that control swallowing are impaired. Dysphagia can be caused by many factors, such as aging, stroke, brain injury, nerve damage, or muscle disorders. However, it can also be a sign of more serious problems, such as esophageal cancer, throat cancer, or thyroid cancer. If you have dysphagia, you may also experience choking, coughing, drooling, regurgitation, or weight loss. You should see a doctor if you have difficulty swallowing that lasts more than a few days or interferes with your daily life. 12. Persistent cough. If you have a cough that lasts longer than 3 weeks, it could be a sign of a respiratory infection, such as bronchitis, pneumonia, or tuberculosis. However, it could also be a sign of lung cancer. Lung cancer is the leading cause of cancer death in both men and women worldwide. It often has no symptoms until it has spread to other parts of the body. Other signs of lung cancer include chest pain, shortness of breath, wheezing, hoarseness, bloody sputum, or unexplained weight loss. If you have a persistent cough that doesn't go away with over-the-counter medications or home remedies, you should see a doctor. 13. Changes in bowel habits. If you notice any changes in your bowel habits, such as diarrhea, constipation, blood in your stool, or changes in the color, shape, or consistency of your stool, it could be a sign of a digestive disorder. Some common digestive disorders include irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, diverticulitis, hemorrhoids, and anal fissures. However, changes in bowel habits could also be a sign of colorectal cancer. Colorectal cancer is the third most common type of cancer in both men and women worldwide. It often has no symptoms until it has advanced to later stages. Other signs of colorectal cancer include abdominal pain or cramps, bloating, gas, fatigue, or unexplained weight loss. If you have any changes in your bowel habits that last longer than 2 weeks or are accompanied by other symptoms, you should see a doctor. Let me know in the comments below, what do you think? Thanks for watching.